So when my staff asked me, do you want to do a TED-like talk at the beginning of convention? I thought, what a great idea. I've never done a TED talk. And then the months went by, and I realized, I've never done a TED talk. And my really helpful staff said, well, all you need is a brilliant idea and a funny, engaging presentation. And I thought, too much pressure. I don't know how to be Ted, but I know how to be Mary. So I'm going to do a Mary talk. And a Mary talk is going to come from my heart, hopefully improve me and help all of us do a little better as we move NAMI into the future. So what am I going to talk about today? I want to talk about kindness and compassion even when it's hard. And what do I mean by it being hard? Well, sometimes it's hard because of how we're feeling. We're sick, or we're tired, or we're sick and tired. And sometimes it's hard because of the object of our kindness and compassion makes it hard. So I think of my daughter, Maddie. She's now 16 years old. But when she was born premature, and she was a tiny little baby with great big lungs, and she cried all the time. She was colicky. And so finally, my aunts and my mom got us to go out for a little while, and we came back, she was asleep. I said, how'd she do? They said she was great. And I was really sleep deprived because I believed them. And years later, they told me she screamed the whole time, and 5 minutes before we walked in, she was so tired she collapsed. And they were kind and compassionate to me, the new mom, and to the baby, and it made all the difference. And if any of you were on a plane like I was with a crying baby, you know it can be hard to be kind and compassionate. Why does it matter? Why does it matter if we're kind and compassionate even when it's hard? Well, the Dalai Lama once said, if you want to make other people happy, practice compassion. If you want to be happy, practice compassion. And it turns out that practicing kindness and compassion is good for us physically. There's this thing called the vagus nerve. I didn't know what it was, but it connects your brain to your organs. It turns out that when that nerve is more responsive, we have less heart disease, less inflammation. And kindness and positive and social emotions actually help that nerve do better. As one researcher put it, it's like a tune-up for the body. So it actually helps you physically if you're kind and compassionate. Who knew? But we at NAMI know that being kind and compassionate helps you mentally, right? When I first started at NAMI, I started talking to an affiliate leader, and she said to me, I wasn't doing very well with my symptoms. I was tired, I was having a lot of problems. And then I started taking NAMI programs. And then I started teaching those programs and leading those support groups, and seeing the effect on other people made me happy and gave me energy and helped me in my recovery. And it's not just anecdotal. We've done some research on our Inner Own Voice presenters. Inner Own Voice is a program we have where we go out into the community and we do presentations with a video, and it's incredibly kind and compassionate interaction with the audience. And we found that those presenters too found a cause and had better connection with their recovery. What about the impact on the people that you're kind and compassionate to? NAMI did a study of emergency room usage for mental health care. Now, everybody here has been in an emergency room, right? And we wanted to find out what made that a good or a bad experience. Well, if you've been in an emergency room, you waited a long time. So you might think wait times was the #1 thing that made the difference. But it wasn't wait times. You might think, maybe it's whether you got the right treatment, right? That's why you're there. Nope. The #1 reason why people had a good experience is whether the staff listened and took their concerns seriously, listened and communicated effectively. That's what made the difference. And what made it a terrible experience is if they made the person feel ashamed of their illness or the illness of their loved one. That's what made the difference, whether someone was kind or compassionate. It also makes a difference in the workplace. As Ron said, I'm the executive director of NAMI, and I'll let you in on a little secret. People don't always agree with the decisions I make. I know, shocking. So I have to figure out what to do about that. And when I practice what I preach, and I know I do not always practice what I preach. I see my staff nodding. Yes, I don't always practice what I preach. But when I do, things go a lot better. When I delete that first email that was unprintable, and I type the next one, when I take a deep breath on a conference call or in a meeting, and I think about the other person's position, and I try to understand that position more, when I'm kind and compassionate, we are much more likely to get to a win-win. And even if we don't agree, we preserve that relationship. Why does it matter with respect to the people who interact with us? So for example, the police. I work with a communication expert, and she told me the story of when she got pulled over for a traffic violation, and when the policeman came to the window, she said to him, "If I were to run, would you shoot me?" And this is because she was depressed. This is where she was that day. She was so down and depressed that she was at that point. And he didn't respond with panic. He didn't respond with complacency or briskness. He was incredibly kind and compassionate. He said, "I understand where you're at today, and I want you to get help. I want you to go home and call somebody and get some help. And when you get to the courthouse, I'm going to be there with you every step of the way, and it's going to be okay." And that was a life-changing experience for her. And I contrast that with a video I saw, and many of you may have seen it. I believe the young man was in Texas, where a young man came out of the house. His mom had told the police that he was struggling with mental illness. He was holding a screwdriver, and the police were shouting at him, yelling, "Drop it, drop it," screaming at the top of their lungs. And he was confused. They shot him. He was on the ground, and they were still yelling at him to drop the screwdriver. And I think to myself, how could that have been different if they had been trained and had practiced kindness and compassion even when it was very hard? It also matters when it comes to providers. Some of you know I take HelpLine calls. That is a super easy way to be kind and compassionate. And I was talking to a mom, and she said her daughter had had depression, and they went into a mental health center. And the front desk clerk was incredibly rude. Now, how many of you have been somewhere, a DMV or elsewhere, where the front desk clerk was so rude? Everybody has had that experience, right? And imagine having that experience when you were very, very depressed. So they went home, and the young woman got worse. And her mom wanted her to go to a crisis center. Do you think that she would go? No, she wouldn't go, because of the way she had been treated. And I often think how that family's life could have been changed if that clerk, that front desk person, had practiced kindness and compassion even when it was obviously very hard. I'm sure it was crowded. I'm sure she was overstressed. But what a difference that would have made. Now maybe you're agreeing with me. You're saying, "Okay, Mary, maybe it's important to be kind and compassionate even when it's hard, but how are we going to do that? How are we going to make a change?" So I'd like to suggest two different sets of solutions, one for the head and one for the heart. So I'm going to start with the head. I think education is really important. Now you're probably saying, "Mary, NAMI already does education." And it's true, we do. We do family to family, we do peer to peer, we do basics, and we teach people how to be kind and compassionate to each other. And that is very important. We need to continue to do more of that. We know we have wait lists. We know we don't have enough classes for the Americans that are affected by mental illness. I had to tell a mom there was no family-to-family class over the summer in her area. So we need to do more. We also need to think about other ways to reach people. So if our courses are, if you think about our classes as the main course, how do we offer people appetizers? So can we get people the information they need when they need it, maybe in person in a short version, or maybe we can use technology, but how can we think about appetizers? And how do we think about takeout meals? So there are people who can't come to the restaurant, right? So we just recently did our NAMI Homefront class. That's a class for the families of veterans and military. And we just did it online. And one of the participants was a mom. And she had 6 children, ages 2 to 16, and a husband who is a double amputee returned from Afghanistan with post-traumatic stress and traumatic brain injury. She did not feel like she could go and leave the family and go to a class. But she was able to learn kindness and compassion for her family through our course online. So how do we think about the future? How do we think about takeout courses? Also, thinking about the police. I talked about the police earlier. Crisis intervention training is a really important training that has a component where it teaches police officers kindness and compassion. And many of you participate in that training and tell your stories, which evoke that kindness and compassion. But currently, only 15% of police departments have crisis intervention training. We need to make it so it would be unthinkable to have a police department without crisis intervention trained police officers. That's right. As one sheriff said to me, Mary, we need to make CIT as sexy as SWAT. That's our challenge. I agree with him. So what about providers? Well, NAMI does provider education, and we do our in our own voice presentations at hospitals and other providers, and that is very important. We need to think about how we can do more of that and reach the providers that are out there. And there are millions of providers, right? So another thing that we're doing is partnering with some provider organizations to do more training, to evoke more kindness and compassion in that workforce. So to give you an example, we worked with Hospital Corporation of America, HCA, on a DVD. And that DVD shows two scenarios. So first, a young man comes into the emergency room. He's agitated, he's a little scared, and there's a lot of people around. And they're grabbing his sneakers, and they're shoving a cuff on his arm. And he's saying all the while, there's a lot of people here, I'm uncomfortable, I'm not liking this. And they're ignoring him. They're saying, we're just doing our job. And he gets more and more upset, right, as people do when they're not listened to. In the second scenario, he comes into the emergency room, same thing, a little bit agitated, a little upset, and all these people are around, but this time when he says, I'm uncomfortable, the nurse immediately introduces herself and says, you seem a little upset. Let me ask these people to leave. We'll leave one person here, and I'll explain to you what's gonna happen. Is that better? And he says, that's so much better. And that DVD's been used in lots of hospitals, and we're hoping to use it in more, but how can we do more to reach providers in the training that they're already doing to make a difference here? Evoke kindness and compassion, even when it's hard. Now I want to talk about the ones for the heart. How do we all do better with being kind and compassionate, even when it's hard? One idea is to think of it as a mantra. So bounty is the quicker picker-upper. Coke, it's the real thing. Can NAMI folks be kindness and compassion? And that's important because in the future, we want to continue to be an organization with a variety of lived experiences. And that means we're not always going to agree. We're not always going to agree on policies or programs or other things. But if we can show kindness and compassion, we can strengthen those relationships and strengthen our organization. We want to reach diverse communities. They're going to want to come be part of us if we're an organization that is kind and compassionate. Another idea is to find a role model, somebody you can think of. For me, it's Jim Payne. Some of you may know Jim, nicest guy you ever want to meet. He's our board president for, I think, 3 more days. And when I type an email or I do a call, I think, what would Jim think about this? And that helps me be kind and compassionate. So who is your Jim Payne? The other thing that I do to remind me to be kind and compassionate is I keep something at my desk, in the front drawer of my desk. I keep a letter, and I'm going to read it to you now. This letter was sent to me on September 26, 2014. It says, to whom it may concern, our son took his life September 19, 2014, after a battle with depression. The loving person that he was, he left a note to comfort us and requested that $1,000 from his savings go to an organization for, quote, those who suffer in silence. He was our gift for 18 years. His memory will always be a gift. It is signed by his parents, and it says we've requested that donation be made to NAMI. Now, if that young man, on a day that he was struggling so much, could think about those who, quote, suffer in silence. That's where his thinking could be. If he could do that on his darkest day, I can do it any day. So I'm going to conclude with a story about my grandfather, because I think it'll help you understand why kindness and compassion is so important to me and the role it has played in my life. And when I was 13 years old, I went through a very awkward stage. Maybe some of you also went through that stage as you're changing from childhood to adulthood. I was very skinny. I had a bad haircut. I wore Wrangler jeans because my mom didn't believe in designer ones. So I didn't feel so great about myself. And I went and visited my grandfather, as I did every summer. And I hung around with my cousin and another young woman, and we went everywhere around the town. We went to the pool. We went to different people's houses. And one day, my grandfather called me inside. And he said, "Mary, why do you always walk 2 steps behind the other girls? You don't have to do that. You can walk next to them, or you can walk in front of them. You're just as good as they are." And I thought to myself, wow, I'd never noticed that before. But he was right. I was walking behind them, and I was looking down. And when I looked into his eyes and saw the kindness and compassion there, I realized to change where I was walking, I was going to have to change a lot more. I was going to have to see myself the way he was seeing me. Years later, he gave me 2 $2 bills. And he said, "These are my lucky $2 bills. Don't ever change them out." He said, "They have brought me luck during life, and someday in your job, you're going to have hard times." I don't know how he knew that, but he knew. And he said, "And when you do, I want you to look at those $2 bills, and you're going to feel better, and your luck's going to change, because I'm going to be there. I'm going to be watching you, and I believe in you." And so my grandfather brings me kindness and compassion from beyond the grave. And if you come to Arlington, Virginia, you will see those $2 bills on my desk. So what have I been talking about pretty much incessantly since I've stood up here? 2 words: kindness and compassion. That's right. And so I'm going to leave you with this quote from an unknown author. "In a world of people who couldn't care less, be the person who couldn't care more." Thank you.